Now, unfortunately, 95% of patients by age 65 have some sort of neck pain, okay? And what causes neck pain? What causes neck problems? Well, it's wearing of the discs. The cushions, the bones are strong, but the discs aren't as strong. And as we age, once we get to about 30, early 40s, the discs themselves, they don't hold up as well. So if you think of it as kind of a cushion, the cushion is or a sponge. The sponge is nice and fluffy, nice and has a lot of water in it. If you leave it sit down long enough, what happens is it kind of dries up and becomes a little bit brittle. And that's somewhat what happens to our discs. And when you start losing your discs, you start getting bone spurs because the bones start rubbing on each other. And also, if you have some abnormal motion in the bones, say there's some of the ligaments or the cloth that holds the bones together, if they become loose, you can start having some rubbing of the bones together. And then also you can have injuries to the joints, which are the little cartilage segments, or the muscles of the neck that can also cause neck pain. Now, what causes a disc to wear? Unfortunately, it's age, because as we age, when we're born, we don't have normally a warranty. So as we age, things tend to wear out once you get to about your 20s, 30s, 40s, some patients even a little bit earlier, some a little bit later. And what that is, when I say earlier and later, that could be a portion of genetics. So somebody may be fortunate where their discs are stronger than others because that's the way they were born. Also wear and tear. So if you're somebody that has a job that requires a lot of movement of your neck, overhead lifting, that can cause your discs to wear out. Also smoking, unfortunately, there's many things that smoking does, and one of them it does is it blocks off the blood supply to the disc. So normally when you're in your 20s and 30s, the discs, they get nice and hydration from the blood supply. If you smoke, what it does is it cuts off that blood supply, so your discs dry out earlier than they would normally. Also, poor posture. If somebody sits at a desk and has poor posture, is looking over quite a bit, or just bad positioning, that can also cause the disc to wear out. And obviously, injury. If you have some type of traumatic injury, either small injuries cumulative over time or major injury that you're involved in, can cause the disc to wear out. This is a picture of, remember that x-ray I just showed you earlier, how you had the nice and square disc. You can see this disc here, or this bone here, it's developing a little bit of spur. This one not as bad, but you see here, you see these big bone spurs that are coming out. And this, see how the space is pretty collapsed? This is the most common area to collapse or get worn out as we age, the C5, 6, the disc between the 5 and the 6. And the reason for that is because that's the area where your neck tends to have most motion. So if it has most motion, it's the part that's going to wear out earliest. Now, what are the symptoms to watch for? Neck pain and cracking sounds. Well, why would you have cracking sounds in the neck? It's because what happens is the cushions that we have, they're not as loose. The bones, the cartilage gets a little bit worn. And as you turn and move, you can develop some cracking. And that's what we call crepitus. It's usually not too serious of a problem because it just basically indicates, hey, we're having some arthritis in the neck. And you can have some neck pain associated with that as well. Headaches, that may be because you have some pinching of the nerves, also because the bone spurs can also refer some pain to the head. You can get head pain. Shoulder pain, generally shoulder pain is pain in the back of the shoulder because the nerves that come from the neck, part of the little nerves go to the back of the shoulder, but also some of the major nerves that go down into the arm, they also send feeling down to the back of the shoulder. Arm pain, because those little electrical cords that I showed you on that previous slide that branch out from the main spinal cord, if those nerves get pinched, you can get pain that goes down the arm. And I'll show you a diagram shortly where it shows pain that can go down to different areas in the arm. Also, hand and arm numbness, because as the spinal cord or the nerves get pressed upon, it can block the signal from your arms to your brain that says, hey, I'm not feeling what's going on down in my arm or hand. Also more concerning would be loss of arm strength or coordination, which we'll also go over a little bit later. And then once things become a little bit more severe, difficulty walking, because the neck holds the spinal cord, part of the spinal cord. So if you have problem walking, it could be a spinal cord problem. This is a slide that basically shows different areas where you can have pain referred from the neck. That's not necessarily a pinched nerve that goes into the arm, but you can have pain in the back of the head and back of the shoulder. And when I say shoulder pain, people, there's different parts of the shoulder that can be painful. Typically, if somebody has what we call an intrinsic shoulder problem or a shoulder problem from the shoulder itself, it's pain in the front. Typically, if patients have pain in the back of the shoulder, it means that it's probably a problem from the neck. So if you have pain in the shoulder, there's a lot of real estate here. Oftentimes, if you're having pain back in here, this area, it's often referred from the neck. If you have pain in the front, it's usually from the shoulder itself. This is a diagram I was just alluding to. Now, those little electrical cords that I showed you that come out of the spinal cord. So here would be the spinal cord. This is the spinous process. Remember, I was showing you how to push in the back of your neck. I can feel that little bump back there. So I would be pushing back here, and I'd feel this bump. That's the spinous process. This part of the bone. Now, I can't feel this far forward because I'd have to go through my swallowing tube and my windpipe to push into here. But here's where the disc is. Now you can see as the nerve comes out, this nerve, say it's the 5th nerve, if that nerve is pinched, it's going to cause pain that comes into here. If it's the 6th nerve, it's going to cause pain and numbness that comes into here. If it's the 7th, it's going to cause pain and numbness into here, and various type of nerve distributions. So if your doctor asks you, well, where does the pain go? Where's it at? We often use pain diagrams so we can determine, because oftentimes it's hard to say, well, my pain is, it's in the arm or it's in the shoulder. Well, where in the arm and the shoulder? This is why we ask you, because if it's being pinched, we can kind of determine, well, that's the area we need to look for. This is a depiction of, this would be more of a depiction of a bone spur right here is pinching on the nerve. Bone spurs here depicted in black. It can cause narrowing of the nerve. Also, this would be a depiction of somebody that has a ruptured disc. The disc itself can push out and cause pinching of the nerve. So you could have bone spurs that pinch on the nerve, or you can have discs that push on the nerve. This is somebody that has pressure on the spinal cord, a little bit more of a serious condition, because when the spinal cord gets affected, it means you're having a higher level of problem, because the spinal cord connects our brain to the rest of our body. So when you start having spinal cord dysfunction or spinal cord pressure, you can start having hand numbness. Now, don't be alarmed if you have hand numbness, because hand numbness could be from many different things, including carpal tunnel syndrome and pinched nerves in the arms, or even just a pinched nerve in the neck. Not necessarily a pinched spinal cord, but it can be an indication of a pinched spinal cord. Hand weakness. So if you start having difficulty with fine motor skills, having trouble buttoning your buttons, having difficulty with handwriting, having trouble holding your keys, that could be an indication your spinal cord is pinched, because you're not having the fine motor dexterity of being able to move your hands. As I said, worsening handwriting, also dropping things. And then once things start becoming more severe, you're going to start having difficulty with walking, which means you start walking like a drunk. You feel like you're losing balance. And that could be a much more advanced indicator that your spinal cord is being dysfunctional. And then bowel and bladder problems, that would be if things get really, really severe, then you've got a big problem, because the spinal cord also controls our urine and our bowels. Now, this is a picture, unfortunately, of somebody that passed but had really horrible neck condition. As you saw, that previous specimen was nice and well hydrated. This is somebody that's, the discs are all dehydrated, the big bone spurs here. Well, how do you avoid doing that? I mean, part of it is you really, some of it's genetics. The things we can alter is we can quit smoking, okay? Because as I said earlier, what happens is the tobacco, what it does is it prevents the nutrition from the bone here to get to the disc, because it cuts off the blood supply right here. Then you end up in this situation. Also, if you do aerobic activities, you increase your oxygen circulation, or basically you increase the amount that you're circulating. You're going to circulate blood through here. This disc is going to get nice and hydrated. Also, avoiding poor neck posture, basically having a good ergonomic situation where if you're at the computer or desk, you keep your neck nice and back, your chest back and your head up and your shoulders back, to keep your neck in good position and keep that nice curvature, the nice cervical lordosis that we talked about. Also, if you have a sore neck, you want to rest it. You don't want to overdo it. If you're overdoing it one day and your neck hurts, well, you probably need to rest it. Okay. And also, there's neck exercises and stretches you can do that help. This is also patients when they take anti-inflammatories. Patients consider these painkillers or pain relievers. Basically, anti-inflammatories act by blocking some of the little molecules and things that cause inflammation. Okay, so if we take say a Advil, Motrin, these are over the counter. If we take those, what it does is it blocks pain, but it also takes some of the inflammation away. And these things, if you take them long term, they can have problems with the kidney and also cause stomach problems. So these are medications you don't want to take too long. But if you do have some recent pain or recent soreness, your doctor may prescribe it for a short period of time. Also using an intermittent neck brace. This would be somebody, more importantly, that if they come in, they have a recent onset of severe neck pain, even a pinched nerve in the arm. Oftentimes we'll place a neck collar just so they don't pinch the nerve anymore. Also, if they have spinal cord problems where they start having the numbness in the hands and they're a little bit too premature for surgery, we say, well, let's try a neck collar, give it some time and observe this. A neck collar would be something to use. And we generally like to use them at night. We can use them during the day, but the reason we use them at night is because when you're sleeping, you don't protect your neck as well as you should, because you're really asleep in your dreamland, and you could tilt your neck, you could bend it back, you could pinch your spinal column or spinal nerves more, and you really don't know it because you're not protecting it as you are when you're awake. Home traction, this is kind of an archaic traction device, but these are, sometimes the therapists can use these things, and what they can do is that those collapsed discs that we saw earlier, they're flattened. This can kind of elevate the disc off the nerve a little bit. I mean, it's not going to restore it to a normal disc, but oftentimes if you restore some pressure off the nerve, it can relieve some of the pain that you're experiencing. Other conservative options, and I won't go into all of these in depth, but physical therapy, if you see a physical therapist, they can show you exercises to do. They can show you muscle strengthening exercises. They can do ultrasound. They can do deep tissue massage. They can also try some traction if you have some nerve pressure. Also, which I won't talk much about today, but it's another topic, is pain management. If somebody has, say, neck pain, okay, there's different injections that they can do to the cartilage joints in the neck and along the ligaments. They can inject some cortisone, and sometimes they can do some nerve blocking procedures where they can block the little nerves that go to the cartilage joints. Also, if a nerve is pinched, say one of those nerves that causes the pain down the arm, you can often block those nerves with a little bit of cortisone and a little bit of numbing medication. What it does, it tends to block the pain passage into the arm. Sometimes it's temporary, but there is studies that show that people that do have a cervical radiculopathy or pinched nerve, that they can offer some long-term relief. Surgical treatment options would be to remove the disc in its entirety, which would be, this would be represented by the disc. So I was like pushing from the front here. This would be somebody that, illustration of the disc being removed and those bone spurs being taken out. And then you put a spacer in between that space in order to fill, so that space is no longer causing pressure on the spinal cord. This would be somebody that had an x-ray image of that. When you call, the technical term of this, you may hear this, is anterior cervical discectomy infusion. And I'll go over that with you in just a second, actually right now. Anterior means front of the neck. Okay, so you're going from the front, you're going through the throat in order to get to that disc, and you get to that bone spur that's pushing on the spinal cord. Okay, cervical meaning obviously disc. Cervical meaning actually neck, and then discectomy, which means taking the disc away, so it's no longer pressing on the spinal cord, and also you're taking those bone spurs off the nerve. And then fusion, which means basically putting the bone plug in here. And then instrumentation is ordered to seal that so that that spinal cord and the spinal nerves are no longer being compressed upon. These are other surgical options. This would be somebody that has severe pressure on the spinal cord here. You see how this, it's hard to, if you don't normally see this, but this spinal cord is flattened almost like a pancake. And it's flattened because there's bone spurs and there's discs that's pressing on the spinal cord. And this would be somebody that was having the numbness in the hands, trouble with dexterity, which means they're having trouble buttoning. It may be that they're having loss of balance or walking like a drunk. And this would be between the fourth and the fifth. And as a surgeon, if it was just one area in the neck, we would have the option of going from the front, like I said, and getting around this area through a pretty elegant surgery that doesn't cause a lot of pain and discomfort. And we can basically take the disc away and the bone spurs, so where the spinal cord is now freed up, and then we would put the bone plug in here and then a plate to hold it together. This is another operation back here where we do surgery in the back of the neck. And I was saying earlier about putting the pressure on the back of the spinous process. Well, this is the spinous process here, and a little bit's been removed in the back as part of the procedure. But what we do in this procedure called the laminoplasty is we make from the back of the neck, we make more room for the spinal cord. So we make a cut here, complete cut, and then a partial cut, and we open this space here, and it makes more room. So you basically made opening the roof, making more room so the spinal cord here is no longer pressed upon. And that's another surgical trick that we have. Another surgical trick that we have, it's been out 10 years, that offers a lot of improvement, usually for people that have pinched nerves, a little bit of people that have, some people that have the pinched spinal cord, but we typically use it for somebody that has more pinched nerves in the neck, where we can actually go from the front of the neck and remove the disc and the bone spurs, but rather than putting a bone plug and a plate that seals up that area, that fuses that segment, we have these prostheses now that allow for motion. These can be done in a 1-hour outpatient surgery. Patients can be back to work in 2 weeks. And it's a very elegant operation that often works very rapidly and with good long-term 10 to 12-year results. This would be somebody that had that type of procedure where he presented with neck pain, arm pain, weakness in the arm that hadn't gotten better with months of conservative care, physical therapy, medications, maybe bracing, and injections. So he opts to undergo surgery, and we do it from the front through a 1 hour, 1.5 hour outpatient operation. We take the disc out, and we basically put little prostheses, just little metal spacers in there to replace the disc. And the cool thing about this is that you see how the neck is, there's still a lot of motion here. Because if you were to see a fusion, you wouldn't see any motion. So this patient regains full motion, neck moves this way, moves that way. And long term, what we do know is it prevents, or we think it prevents, but that it takes less pressure off this area. So long term, this area doesn't go bad and the area below doesn't go bad. So when do you want to see your doctor, right? Persistent neck pain. So if you have a neck pain that just doesn't go away, say after resting a few days, maybe taking some anti-inflammatories, maybe just resting your neck, that would be an indication to see your doctor. Also, if you're starting having some shoulder pain, like I said, pain in the back of the shoulder, because that can be referred like a pinched nerve in the neck. Also, particularly if you have arm pain and numbness, because that would indicate potentially that nerve in the neck, or at least one nerve or maybe more than one nerve in the neck, is being pinched. Also, more concerning would be these last three if you start having arm and hand weakness. So if you start dropping things, or you notice your arm is not as strong as it was, and you're dropping things, that would be an indication, hey, I probably need to get checked out because I could have some serious problems going on. Also, worst case would be if you start having trouble walking, and that can occur abruptly if somebody has, say, pressure on their spinal cord and they hit their head and they can't walk. That would be a pretty emergent or urgent type of thing, but it can occur gradually. And usually somebody that has trouble walking from a neck condition, they've already started to have some arm and hand weakness, and then the trouble walking follows. You want to seek immediate medical help if you have sudden onset of weakness in your arms and hands. And in the hospital, unfortunately, we see people a lot of times in the emergency department that they may or may not have known they've had neck problems, and then they hit their head, and all of a sudden they have weakness and numbness in the arms, and we need to treat them rapidly. Okay. Also, if you have rapid onset of difficulty walking, if you have any trouble with your bowel and bladder, that would be definitely an emergency type thing. And also, if you have severe uncontrolled neck pain or arm pain, because there are other conditions besides bone spurs and disc ruptures that can occur. Oftentimes, you can have infections and things like that can be very serious, and the way it's going to present itself is severe uncontrolled neck or arm pain. Things to remember: you want to make sure you stay fit. You avoid smoking and tobacco products, because we can't affect our genetics, but we can affect our lifestyle. If you have a sore neck, you injure your neck, you're having problems, you want to make sure you rest it. You don't want to overdo it. You want to take a rest, use some stretching, and maybe take some anti-inflammatories, and also to avoid strenuous neck posture. Thank you, and hopefully we have some questions that propped up, and there's no stupid question, and just be free to ask any type of question.
Dr. Alegre, I do have a couple questions that were submitted in advance. One of them you touched upon, because you talked about pain in the arm radiating through the shoulder. Another question has to do with posture, and it was about sleeping positions and pillow. Is there a better, a right or wrong? What's your advice on that?
Generally, you want to have just one pillow, not two pillows. You don't want your neck to be propped up where you're bent forward. You want to be basically in kind of a neutral position. Some people can put pillows long ways where they come into the long this way, so your neck isn't propped up, but it's more of a neutral type position. Anything that keeps your neck in more of a neutral position so you're not extended, because if you're extended, what's going to happen is it's going to pinch the nerve to the arm. And I didn't put it in this presentation, but when you extend your neck, what happens is those bone spurs can kink the nerve, and they can also kink the spinal cord. So you want to make sure that your neck is in kind of a neutral position. So it's basically not tilted or not bent forward it back. And there's really no special pillow or anything. It's basically a pillow that you feel comfortable in. I just would advise you not to use multiple pillows where you're sleeping with your neck in a bent over posture, or sleeping with no pillow or something that's causing your neck to be extended.
Okay. Another question is, when you've had chronic neck pain, at what point do you finally know that it's time for surgery?
It's time to have surgery when you failed all conservative care. You see a reputable surgeon that says, yes, these are your options, these are your risks, these are your benefits. Not all neck problems are surgical. I mean, it depends on what the situation is. Generally, as surgeons, we start talking about surgery if somebody has uncontrollable arm pain or weakness, or they have the things we talked about, the serious things such as the weakness in the arms, loss of balance, because those things are irreversible. If you're treating pain, it's really more of a patient decision, it's a doctor decision to say, hey, I think we've exhausted everything, and I think these are the reasonable treatment options for you. So it's a difficult question to answer without consulting with a patient on that one.
Okay. Another question is, when someone has had neck fusion, does that make them more susceptible to having other fractures or spine or neck problems?
Yes, there's a classic study that was done out of Ohio years ago where the doctor had done thousands and thousands of surgeries, and they were to follow these patients over time that had a neck fusion. And what they found was there was about a 3% chance, 3.5% chance per year that the patient would require surgery at the other levels. So we generally tell patients that if they've had a spine fusion or cervical fusion, in about 10 years is about a 30% chance that segment above or below may wear out. We're thinking that hopefully, patients, we can do more of the disc replacements, that would kind of lower that level. And we do know that patients that have a disc replacement versus a fusion operation, if they're a candidate for it, that the reoperation rate is less in the first 10 years. So to answer that person's question is, yeah, there is some additional risk, because what happens is it does put more strain on the adjacent levels. But hey, if you're looking at contemplating, do I have some risk of having some adjacent level disease, or risk that my arm's going to be permanently numb and weak, I would probably advise to take the potential chance that, yeah, I may have some adjacent level problems in the future, which is about 3% per year.
Those are all the questions that I had that were submitted in advance. I don't see any in the chat right now. If anybody wants to open their microphone or submit something to the chat, we have some time.
Thank you, doctor, for your presentation. It was everything that I'm experiencing. As far as maybe coming to see you, do you offer office hours as a surgeon, or maybe just the very beginning stages of seeing what's going on?
That's a great question. Office hours as a surgeon, it's funny, I'm not funny, but I spend most of my time in clinic seeing patients, and most of the patients I see don't need surgery. I would say probably 90% of the patients I see don't need surgery. So most of my time is spent with patients, doing patient care, going over results of x-rays and MRIs, and doing therapy and referring out for injections. So yes, I do have office hours, and my office hours are throughout the week. I operate 1.5, 2 days at most. Yes, and Alpine Orthopedics would be the office to contact.
Okay, I'll see you soon.
Anyone else? I'll tell you, Dr. Alegre, it made me sit up straighter, my posture, when you were talking.
Well, I mean, it is very simple. I mean, it's simple enough. I mean, you keep your chest out and your head up, and that alone reduces a lot of problems. And people slouch over, they keep their neck, and that alone, if you do that, you got a 20-pound ball here. I mean, you're putting a lot of pressure on a little stick. So if you keep your head up, your chest out, that alone, is a bonus, and it's going to help you out.
I'm a sloucher at my desk, I will freely admit. Does anyone else have anything? Okay, it looks like we have one. It's saying, are there any natural remedies in addition to healthy habits to prevent disc problems?
There's some studies that suggest fish oil does help. Turmeric does help, but I was just at a cervical spine research society recently, and there was some evidence that if you take fish oil, that it does have some anti-inflammatory properties. It does improve neck pain. Now, whether long-term it prevents you from, going further in degeneration, it's difficult to tell. But I do take fish oil because it has been recently found to be beneficial for neck problems, and also it's good for heart health and other ailments.
What about glucosamine and chondroitin? I've heard about that for other joint problems. Does that have any benefits for the neck?
There was some anecdotal evidence that it did help with the joints, but that never really bore out, and it hasn't been borne out for the neck.
Thank you. Anyone else?
Yeah, I'm wondering if you found that psoriatic arthritis has been a contributor to that area as far as being a more sensitive to damage.
Yeah, so psoriatic arthritis is an inflammatory arthritis, and it does affect the joints. So yes, there is an increased rate of having spinal problems, among other joint type problems with psoriatic arthritis. Also, the more severe one is rheumatoid arthritis, because rheumatoid attacks the joints, and we have multiple joints in the neck. I didn't really go over it too much in detail, but there's those little facet joints, and you have a bunch of little like knuckle facet joints in the neck and then also in the back, and it attacks those joints. And what can happen is the bones can start slipping, and then they start causing pressure on the spinal cord. But psoriatic arthritis does cause some increased inflammatory reaction. To answer your question, yes.
Yeah, I definitely have to consciously walk straighter, or otherwise I end up looking like I'm carrying stuff in both hands. I'm bent over, and I think that's contributed to the neck problem too.
I would suspect it is.
So yeah, maybe you could suggest a physical therapy situation. I might have to come in and see you on that. But
yeah, I think that'd be great. And then, just getting into a physical therapy exercise program, and also if you could do non-impact aerobics is helpful. Basically keeping limber and keeping good posture, because with inflammatory type arthritis, you develop more stiffness. Your body wants to become stiffer, and you try to combat that by becoming more flexible and it also keeping good posture.
Yeah, it does help when I'm more conscious of it. But yeah, doing things that old habits, trying to undo them at the same time I'm trying to support the back. Yeah,
absolutely.
Thank you.
You're very welcome.
Anyone else? I do have one, Dr. Alegre, that I missed earlier, that was asking about the relationship between osteoporosis and the neck.
There's not a lot of relationship between osteoporosis and the neck. We worry about osteoporosis, which is basically weakening of the bone. It usually affects, or at least it affects all the bones, but we don't worry about it as much in the neck because it's rare for somebody with osteoporosis to break their neck. They can, but we generally see that in the T's and the L's, or the thoracic and the lumbar, because those are the ones that take more of the load on our body. So osteoporosis, it doesn't affect the discs or the nerves, but it affects the bones. And as surgeons in the neck, we get concerned about osteoporosis is if we're operating on somebody and we have to put screws or hardware or implants into the neck, and then you're putting them in really weak bones, it makes it much more difficult for both the patient and the surgeon, because you have to be extra careful. And sometimes the bones, they're not as strong to hold up when you put screws in there. But that's a great question. But osteoporosis is something that we get more concerned about it when you're talking about the T and the L spine, because those are the ones that if the bone is weak, a patient can just fracture by minimal trauma, or if any trauma sometimes.
Thank you. I think that's it, unless anybody has anything else.
I do have one question.
Okay.
I'm currently, thank you, Dr. Alegre, for the presentation. It's great. I'm currently your patient. I had seen a UC Davis doctor kind of recommended acupuncture. I want to know what your thoughts are on acupuncture. I had some left ear pain, but I'm waiting for my MRI and physical therapy, and I can't wait to see you again. But what are your thoughts on acupuncture?
I like acupuncture for a lot of reasons. One is it's not very invasive at all. We don't know quite how it works, but it does offer pain relief, often for chronic pain. I like it for what we call myofascial pain, which is basically the muscles and the ligaments are causing pain that we don't quite understand why people are having pain from those areas, but oftentimes acupuncture does help. If you have like a pinched nerve, acupuncture, I'm not sure necessarily much benefit to it, but if you have more localized pain along the shoulder area and the neck, it can help. But if it's a problem where you're having the pain down the arm or the weakness in the arm, I wouldn't necessarily recommend acupuncture for that. But if it's pain and you don't have a lot of pinched nerve types findings or symptoms, then I think it's something definitely to consider, and I do recommend it quite frequently.
Thank you. Thank you so much.
You're welcome.
Okay, well, if there isn't any other questions, thank you, Dr. Alegre. And to everyone else, Dr. Alegre, as he said, his office is Alpine Orthopedics. So if you need to call them and make an appointment with him, you can do so. And the recording will be available on our website, which is www.stjosephscares.org.
Thank you very much.
Thank you.